There are a good amount of people here that have talked to Extend Health already. If you haven't, sometime in the next week or so, give us a phone call with your doctors, your drugs, your red, white, and blue Medicare card information. Okay, give us a phone call. Two things before we go to some frequently asked questions. The first is just driving home the idea that we are an advocate for the retiree. So whether it's a claim issue or concern about how your drug plan's working, or you're moving, or you're, whatever it is, give us a phone call, and if it impacts your health care, we'll walk you through that process. Okay? We take care of that for you. That's our job. That's the majority of our job, and certainly our most important job. Finally, every year, during the annual enrollment period, you will have an opportunity to reevaluate your health care plans. So if you want to reevaluate your drug plan next year or your medical plan next year, you're absolutely welcome to do so. Extend Health will proactively reach out to you and make sure you're still happy with your plans. If you are, great. You just keep paying your premium. You don't have to re-elect. Just keep paying your premium. But just keep in mind, you will have an opportunity to reevaluate your policy should you want to next year. Now I'm going to have my colleagues gather your question cards. So if you wrote down questions on your yellow cards, hand them over as these folks come through. And then while they're doing that, I'm going to answer some pretty basic questions here. The first is, do you offer plans that cover me in multiple states? I am a snowbird. Okay? The Medigap policies, again, are not network-based plans. So they're a powerful option for people that live somewhere else 6 months of the year. You can go see any doctor or go to any hospital that accepts original Medicare. The drug plans provide nationwide coverage. Okay, so they are not really network-based in that same capacity. I remarried after I retired. Is my spouse eligible for Extend Health services? Although your spouse is not eligible for a subsidy, we can still assist you with that process. We help the general public and anyone that needs our help. How often will I be billed and by whom? Can I pay by check? The first payment, in most cases, needs to be done electronically. After that, if you are more comfortable sending a check every single month, we can help facilitate that with the insurance carrier, but it's just more paperwork for you. In most cases, when we're talking through an enrollment application on the phone, you'll have the opportunity to select the day that you're billed and how often that you will be billed. If I don't like the plan that I enrolled in, when can I change? So again, we're going to take a lot of time to find out what's important to you and help you select the correct plan the first time. But every single year, again, we reach out to you to make sure you're happy with your health care and help you make a change if necessary. Will my premium rates increase every year? If so, by how much? Medicare Advantage has actually stayed very stable as far as premiums go the last few years, between, I think 1% and 2% below and above what it was a few years ago. It's not fluctuated that much. The Medigap or Medicare supplement, you can expect to see a 2 to 4% increase in premium every year. Will I be refused coverage due to pre-existing conditions? You will not. What if I have the option for other coverage? So if you have TRICARE, VA, a group plan through a spouse, make sure the benefit advisor knows. And if we can coordinate and make sure you get your funds and have the most rich coverage possible, we will certainly do that for you. How does Extend Health make its money? Will our services be free next year? Of course, we're not going to charge you to talk to us. So when we help you enroll in a policy, we do get a commission from the insurance carrier. Now, that's how we make our revenue as a company. Can I obtain medical and prescription drugs from one carrier, or will I need separate plans for each? So again, Medicare Advantage is one comprehensive plan. Okay? The other option you have are Medigap plans with a separate drug plan. If you choose the Medigap plans, you might select AARP or Blue Cross Blue Shield for your medical purposes. However, you might select Aetna and Humana for drugs. It's customized to fit your individual needs perfectly. Are there plans that will cover me when I travel domestically or internationally? Domestically, certainly. If you ever have an emergency, these plans are going to cover you. Internationally, sometimes a different story. The Medigap plans do provide up to $50,000 for coverage outside the country, but they spend most of that money trying to get you back stateside, to get coverage here. Medicare Advantage plans will do it too. Let's go through some of these questions here. How do benefit advisors get paid? So again, I'm salaried. The company makes its revenue from the insurance carriers. Your benefit advisor is whoever answers the phone when you call. Explain your. So whenever you call and talk to a benefit advisor, they're going to be licensed in Ohio. When you call back, you will be routed to that last benefit advisor you spoke to. So you keep the same person throughout the process. Okay? This is your health care. If you don't like your benefit advisor, it's okay. You can ask to speak to someone else. But you're going to like all of them, I think. If we choose to keep current Delta dental insurance, do we need to do anything? And I believe Battelle said the answer is no. You're just keep doing exactly what you're doing. Spouse not eligible for Medicare until 2013. What does she do now? She'll stay on the group plan until she does turn 65. 3 months prior to her 65th birthday, Extend Health will reach out to begin the process. Will HRA deposit be tied to inflation? Battelle has indicated that they are going to periodically review the HRA. Will husband and wife have a separate health plan? Yes, they are separate and individual policies. Are 2 phone calls needed for enrollment? The answer is no. You could do it together on the telephone. How does the new government health care affect this program? So the Affordable Health Care Act is doing a lot of things. It's removed limits on how much a plan will pay for certain things. It's providing bone density testing and colorectal screening free of charge. Diabetes education, smoking cessation treatment. It is doing all those things. The biggest thing the Affordable Health Care Act is doing for retirees that are Medicare eligible is minimizing and phasing out this coverage gap or donut hole. There were some of you that were groaning a bit about it, but it is going away. By 2020, the donut hole will be completely phased out. Several years ago, you were responsible for paying 100% of the cost of your medications in that coverage gap or donut hole. Okay? The pharmaceutical companies that are out there making billions of dollars in profits are beginning to absorb some of the cost of your medications in the coverage gap or donut hole. So it is going away. If one does not wish to participate with Extend Health, will the HRA be paid directly to the retirees? No, you have to work through Extend Health to get that HRA. Is Extend Health contemplating adding insurers to its list of MAPD insurers in Central Ohio? Of course. We have a carrier relations team that is responsible for bringing on new insurance carriers every single year. We're constantly looking. How do I factor in long-term care insurance? Completely separate and independent. If you have long-term care insurance, that's fantastic. They are fantastic policies, but it has nothing to do with your health care related to this. Once enrolled, do I talk only to Extend Health? We would like that. That's the goal, is to have us be your primary point of contact. So there's no need to talk to insurance carriers. You can talk to whoever you'd like to, though, but we are your primary point of contact.